The question is about blood pressure, things that can help blood pressure, supplements to take, and how you can actually control it. I think the first thing to think about is what is blood pressure? And there's a good analogy to thinking about it. Blood moving through blood vessels is similar to plumbing. Imagine water moving through a pipe. And there's a few factors that are going to influence the pressure inside of that pipe. If we think of fluid moving through a pipe, if there's more fluid going through, that's going to increase the pressure. If the pipe is thinner than it should be or smaller than it should be, that's going to increase the pressure going through. If the walls of the pipe are quite stiff, then it's not going to be able to expand as much. That's going to increase the pressure. And if the fluid itself is quite thick or thin, that's also going to influence the pressure. Those are the different factors that influence blood pressure as well. And there's a few things that actually have an effect on this. The first one that we know is salt, sodium. Increased amounts of sodium inside your blood, we know that sodium is what we call osmotically active. It absorbs and attracts water with it. Wherever the sodium is, water follows. So if there's more sodium inside of the blood, then there's more water inside of the blood. And that means there's a higher volume of blood, which will increase blood pressure. Another thing that makes an influence on blood pressure in human beings is actually the kidneys. The kidneys are very much the more sensitive out of all of the organs. Even a small drop in blood flow to the kidneys will cause them to start panicking. And when they panic, they release something called renin, which goes into something called the renin-angiotensin-aldosterone system, RAAS. Now, without going too much into detail, this release of renin causes an increase in blood pressure because the kidney is trying to force more blood towards itself. And so if the kidneys are not very good, they're dehydrated, or there's kidney problems, this will cause an increase in blood pressure. And the last thing we know that influences it is your sympathetic nervous system. When it comes to your body, there's two major types of nervous system. There's your sympathetic nervous system, which is your fight or flight nervous system, responsible for making you active, more stronger, more faster. And there's your parasympathetic nervous system, which is your rest and digest system, which slows you down, allows you to do other metabolic processes. Now, if your sympathetic nervous system is activated, which can be done pretty easily through exercise and crucially stress, then your sympathetic nervous system will cause an increase in your blood pressure as a result. How do we get this down? Well, most cases of hypertension are what we call idiopathic, meaning we don't know the exact cause as to why that person's blood pressure is high. But we do know a large part of these people that have hypertension do have issues with salt metabolism. So they're not very good at dealing with salt, or they're very sensitive to sodium and salt in their blood. A very good, quick, natural way of reducing blood pressure is to cut down your salt intake. And a second very good way of doing so is making sure you're very well hydrated, making sure the kidneys are functioning very well. Your kidneys love water, so you have to give them all of the water, and you're aiming for 1.5 to 2 liters of water every single day. This will ensure your kidneys are hydrated very well, so they can perform the function that they need to do. Another very important thing to do as well, other than just staying well hydrated and cutting down your salt intake, is to manage your stress levels. Lifestyle problems, not sleeping very well, relationship issues, things of that nature will cause stress. That will activate your sympathetic nervous system, which will increase your blood pressure. So that's another way that you can manage your blood pressure. There are medications that you can use for blood pressure. We actually have a bit of an ABCD approach. So A meaning ACE inhibitors, B meaning beta blockers, C meaning calcium channel blockers, and D meaning diuretics. All of these drugs can be used to manage blood pressure. Cut down salt intake, stay very well hydrated, reduce your stress levels. Medications wise can be ACE inhibitors, beta blockers, calcium channel blockers, or diuretics, and this should be all you need to manage blood pressure.